My name's Michelle Pacilio, and I'm a pelvic health physical therapist at Ohana Sports Medicine, which is a physical therapist with specialized training in pelvic floor disorders like incontinence, post pelvic organ prolapse, bowel disorders, pelvic pain, bladder pain, um, and things like that, GI problems, sexual dysfunction, and also pregnancy related issues, post pregnancy, during pregnancy. Um, it is my calling and it is my passion to spread the word about pelvic health, to destigmatize pelvic issues, and help all women achieve their postpartum goals, whether it's holding their babies without pain, or jumping on a trampoline with their kids without peeing, or returning to CrossFit. My inspiration to create and host this postpartum workshop actually came from my patients, my new moms and my not so new moms that were coming to me complaining about leaking and a strange new bulge in their vagina that they'd never had before, constipation, painful intercourse that they thought they were cleared to have at 6 weeks. And a lot of them really just felt like they weren't prepared for all the changes that came with postpartum. So luckily, I was able to reach out to an amazing group of women that specialize in postpartum care and share my passion in helping women to overcome their obstacles and achieve their best lives. And they have graciously donated their time and expertise to this workshop in the midst of a pandemic because they know how important it is for our new moms. So treating women needs to be an individualized and holistic approach. Treatment must encompass a variety of aspects that contribute to balanced health, including the physical, the psychological, the emotional, the hormonal, the nutritional, and spiritual well being. And this is what this workshop hopes to convey. So, we really want to give all moms the tools and guidance that they need to not just survive postpartum, but to thrive in postpartum and beyond. As a pelvic PT, I am so excited to share my passion with you and bring you evidence-based information on the changes that occur in your pelvic floor and your abdominals after pregnancy and delivery, as well as how you can help identify problems and start improving on them. So the pelvic floor is an amazing structure. No other muscle in the body can stretch 350 times its own length as the pelvic floor does in childbirth. But because of its ability to stretch so much, it can often be susceptible to dysfunction, which left untreated, it can last for a long time. So one study shows that if moms have urinary incontinence 12 weeks after postpartum, they have a 92% chance that they'll still be leaking 5 years later. So first we're going to look at the anatomy of the pelvic floor. There's our pelvic floor. It attaches from the pubic bone to the tailbone and both sides of your sitting bones or your ischial tuberosities. It acts like a hammock to support your abdominal organs, and it helps function. It helps function in controlling urination, defecation, sexual activity. But one of its primary functions, it's one of the primary core muscles in the body, with the transverse abdominis in the front, multifidus in the back, and diaphragm on top. There you go. So these muscles work beautifully together to control intra-abdominal pressure, which is pressure that gets generated in your abdomen with activities like coughing and sneezing and getting up out of a chair and lifting your baby and jumping and having a bowel movement. So they act like a canister, you see that Coke can, and they control and they regulate pressure. So when the canister is strong and everything's well coordinated, the pressure stays inside. But if that canister becomes weak and it's not working optimally, like when your pelvic floor and abdominal muscles are after having a baby and pregnancy, all that pressure from the inside can start to push on those weakened structures. And that leads to leaking, diastasis, rectus, abdominis, which we're going to talk about in a little while, and pelvic organ prolapse. This is pelvic organ prolapse. And a lot of women will experience prolapse after delivery. In fact, research shows that 30 to 50% of all moms will experience some degree of prolapse in their lifetime, and it's reported as one of the most common reasons for surgery in women. Yet, 48% of women have no idea what prolapse is, and they have no idea how to manage it. So my goal is to change that number through pelvic physical therapy and education. So prolapse begins when there's too much pressure from above, such as weight gain, chronic straining, like in like a heavy delivery, repetitive heavy lifting, chronic constipation, or even holding your breath. And all that pressure can push down our abdominal organs and push them towards our vagina, eventually overstretching all the connective tissues that hold these organs up. So a lot of symptoms of pelvic organ prolapse include pelvic heaviness, maybe a bulge in the vagina, and it might get worse if you're lifting or if you've been standing for a long time. You might have leakage, or you might have difficulty emptying your bladder or your bowels. So I'm experiencing prolapse after childbirth. It can be kind of uncomfortable and a little unnerving. But know that there's tremendous healing that takes place for months following delivery, and there will likely be improvement in your prolapse over time. But if it doesn't improve, there's still so many things that you can do to actively help it improve and prevent it from getting worse, and still enjoy all the activities that you want to do. And that's why it is so important to work with a pelvic health physical therapist to guide you in the treatment of your prolapse and other pelvic issues. So in a perfect world, your pelvic floor and abdominal muscles, they work synergistically, and they're anticipatory, meaning they are already co-contracting before you even think about starting an activity. Very cool. However, after pregnancy and childbirth, whether it's vaginal or C-section, your pelvic floor muscles and your abdominal muscles can change due to injury, overstretching, and they can become discoordinated, losing their ability to effectively manage that abdominal pressure that I was talking about. Sometimes these muscles can become weakened and overstretched, but more often, and what I find is these muscles can become very tight and lose their ability to contract or relax. They literally get stuck in a shortened position. And tight pelvic floor muscles are also one of the main reasons for painful intercourse following delivery. So what I'm going to teach you today is what I usually teach all my patients on their first visit, and that is how to correctly contract and relax their pelvic floor muscles and coordinate it with their breath. So what I'd like you to do is you're going to sit up nice and tall. If you could sit on a firm surface or a ball, that would be great. You could also take a yoga mat, like a rolled up yoga mat or rolled up towel, and sit on it, kind of like you're riding a horse, right? So you can feel it underneath your perineum, or better yet, y'all have hands. You can put your hand in your perineum, right, and feel this movement. So what we're going to do first is we need to breathe, because the breath is so important when it comes to pelvic floor and just that coordination of all those deep core muscles. So you want to think of the diaphragm, which is way up here, right, under your ribs, and your pelvic floor is working together. So when we inhale, the diaphragm goes down, the pelvic floor muscles should relax. When we exhale, the diaphragm goes up, and the pelvic floor muscles should lift up or contract slightly. So we're going to try, in a perfect world, that's the motion, like a piston, back and forth. So first, we're going to work on breathing. Hands are going to go a little bit at your rib cage and your belly. So I want you to be able to feel your ribs and a little bit at your tummy. Sitting up really tall posture really counts when you're working on any kind of pelvic floor and core strengthening. So you're going to take a big inhale. I want you to feel your rib cage widen and your belly expand a little bit. And then you're going to exhale. Feel your rib cage come back down, belly soften. We'll do this a couple more times. Inhale, rib cage expands, belly expands. Exhale, and then it all comes back down. So just very gentle, not really forced, but just trying to feel that movement. Inhaling, rib cage lifting up like balloons under your armpits, and they're just lifting you up, and exhale, coming down. Okay, so now we're going to bring our awareness to our pelvic floor, and we're going to first focus on relaxation, or what's known as the reverse Kegel. So this is where that hand may come in handy. No pun intended. So you're going to inhale first. As you inhale, fill up your lungs and your belly with air, and imagine your pelvic floor muscles are softening, like something is trying to pass out of your pelvic floor muscles. Good. And as you exhale, it just comes back to normal. So big inhale. Imagine your sitting bones as you inhale that they're spreading, and then you're sending all that air down into your abdomen, down towards your pelvic floor muscles to get them to relax. Put your hand under there. I want you to see if you can feel some pressure going into your hand on your inhale. So big inhale. Belly and ribs, feel some pressure, some broadening in your pelvic floor, opening in your pelvic floor, relaxation. Exhale, it just comes back to normal. Good, good. So if you can't feel anything, you're like, well, I don't feel anything. That's okay. It takes practice to feel these muscles moving with your breath. It's very subtle. But with practice, you should be able to feel it. And it's really important, especially if your muscles have a tendency to be on the tighter side. So just like anything, relaxation takes practice. So now we're going to work on trying to activate our pelvic floor muscles. So we always want to start with our breath. Our breath kind of controls the whole thing. And we want to start with an inhale and a relaxed, lengthened pelvic floor. So big inhale. Think of relaxing and separating, opening your pelvic floor muscles. On your exhale, I want you to activate those pelvic floor muscles like you're trying to pick up blueberries with your vagina. Yes, I said blueberries. And you inhale, you relax them, drop your blueberries. On your exhale, lift your blueberries. You might feel a little tension in your lower tummy. That's totally fine. That's your transversus abdominis. It's supposed to work with those pelvic floor muscles. If you're getting a lot of tension through your abdominals or your glutes or your shoulders, that's way too much. Try to really just isolate, make it a little easier. It shouldn't be, you're not cracking things. You're just lifting blueberries. You're not trying to squish them. And on your inhale, you're letting them go. And it doesn't have to be blueberries. You can imagine lifting a jelly bean or a slippery marble with your vagina. Or my favorite is trying to drink a thick milkshake through a straw with your vagina, right? Whatever you can get to get your brain to connect with these muscles, you need to work those cues. So making sure that you're leaving equal time for relaxation and that nice inhale and softening. So when you feel like you can actually coordinate these muscles and feel that relaxation and that gentle lifting and coordinate with your breathing, then I want you to try to do it in all different kinds of positions. Sitting, standing, lying, standing on one foot, going on all fours. These muscles have to work dynamically in all positions. As this gets better, you can start increasing the time of your holds, holding for 5 seconds, 10 seconds, for up to 10 repetitions a few times a day. But make sure that between your repetitions, you are paying attention to that relaxation. Those muscles are relaxing fully and you're giving them the time they need. Once you're able to control and coordinate these muscles with your breath, you can begin starting to add other functional movements like squats and bridges and lunges and marching and eventually hopping and running. These pelvic floor muscles need to coordinate dynamically with all of your movements. And just doing Kegels alone is not sufficient to create that really good pelvic floor strength and function. So you have to do it with other activities. But give yourself time to progress. It could take months before these muscles are strong enough for more ballistic movements like jumping and running. And returning to vigorous activity too soon may actually worsen your pelvic floor symptoms. So remember, if you're experiencing any leaking, pain, bulging, or pelvic heaviness during activity, it's not normal and it's too much for your body right now. But working with a pelvic physical therapist can really help you identify these problems and provide you with safe alternatives to steadily increase your function. And with progressive and consistent pelvic floor and pelvic girdle strengthening, you should be able to return to all your activity. So second half here is now we're going to talk about diastasis rectus abdominis, which is that split down the center of the abdominals. So I'm going to go back to my slides here so we can kind of give you a little information here. So because the abdomen has to get so large when you're pregnant, the connective tissue that lies between the rectus abdominis, right here, your little six-pack muscles, this is called the linea alba. This has to stretch to make room for baby. Has to stretch. In fact, 66 to 100% of all moms will have a DRA in late pregnancy. And 36% of moms will still have a DRA at 12 months postpartum. So DRA has been implicated in different things like decreased lumbopelvic stability, low back pain, incontinence, prolapse. But there's really no consensus in the research of if it actually does those things. So a lot of people think it does, but there's a lot of conflicting research. So here's some different shapes of what a diastasis might look like if you're doing like a little curl up if you're laying on your back. So when we look at social media or online apps and different things like that, online information, the emphasis is always on how to close the gap and what exercises you should never do, like crunches and planks, because they think it'll make the gap larger. However, there is little evidence that a smaller gap will actually improve function, or that these exercises that when performed appropriately will make the separation worse. There is significant research on the benefits of a strong functional abdominal wall on managing abdominal pressure and transferring load, like lifting and carrying a baby, right? So maybe we need to shift our instead of focusing on trying to close the gap, we should be focusing on trying to create a strong, dynamic abdominal wall. And that's why I love this slide. It's not the size of the gap that matters so much as the strength of it. All right, so wrap your brains around that. It's not the gap. Let's get you strong. We could have people with really large gaps and have amazing abdominal strength and abdominal function. There is also not a consensus on the most appropriate exercises to improve diastasis. However, newer research is showing that activation of your transverse abdominis, which is that deep tummy muscle that we were talking about, can help generate tension in the linea alba and improve abdominal function. So what we're going to work on now, this is where you might need your yoga mat. We're going to work on, I'm going to show you how to identify a diastasis and how to activate your transversus abdominis. So when you go do other exercises in the gym or with other instructors or watching videos, you're able to appropriately engage those muscles and know if those exercises are appropriate for you. So what I'd like you to do, I'm going to angle this down. You're going to lie on your back. All right. You're going to lie on your back with your knees bent. Hopefully everyone can see me. Okay. Down a little bit more. There we go. Lie on your back with your knees bent. Okay. You get to see my tummy. Here it is. All right. So first, you're going to take your fingers and you're going to move them horizontally, right? This way. And you're going to stick them in your belly button. And you're just feeling for any tension, right? Is there tension? Do your fingers go way down, or is there a little bit of resistance? And then you'll do the same thing about an inch or so above your belly button. Don't push hard, but just kind of observe what you're feeling. And then a little bit below your belly button. Okay, so we're just feeling for tension at that linea alba. Now, lift your head up. Go back to your belly button with that horizontal fingers. Do you feel a separation between those recti muscles, right? Is there a little gap? How many fingers can you put in that gap? Does it go way down? Are you able to sink way in, or is there a little tension? Do it above the belly button. How many fingers can you fit in there? Do it below the belly button. All right, so that's a diastasis. So remember, well, not remind, I haven't told you yet, but 2 centimeters or 2 fingers width is considered normal. So if you have 2 fingers width or less, you don't really have a diastasis, okay? But larger than that, that's considered normal, because people without having babies can have 2 finger width diastasis. So, all right. So now what we're going to do is we're going to find our transversus abdominis. I want you to put your hands on your pelvic bones right there, okay? And then go in about an inch. Gentle fingers. Your transversus abdominis runs horizontally and it acts like a corset. So I want you to imagine, we're going to use our imagination again, a wire attaching from your pelvic bone to pelvic bone, okay? Imagine that wire is getting tighter, drawing these 2 pelvic bones towards the center. Now gently lift your blueberries, right? So we're gently engaging our abdominal muscles, and you should feel some tension develop under your fingers. You shouldn't feel any bulging, right? If you're feeling bulging in your tummy, you're working too hard. That's your obliques. Back off a little bit and feel some gentle tension. That's your transverse abdominis. Keep your pelvic floor muscles engaged. Now, keep those muscles working. Lift your head up again and check your diastasis. Does it feel different? Do you have a little bit more tension between those 2 recti muscles? Maybe your fingers don't go down as far. Maybe those muscles are a little even closer, right? So we're just seeing how activating those deep core muscles can change your diastasis. So when you're exercising, this is what you should be doing. You should be checking to see if your diastasis is getting larger and bulging and coning, right? Making that little peak, or if it's going way down, activating that transversus abdominis. If you find that that's what's happening, then that exercise, whether it's an abdominal exercise or another exercise, might be too difficult for you right now. Doesn't mean that you can't get there eventually, but it just might be too much for you right now. But that way you can check and see how your abdominals are doing with multiple different exercises and progress. So working with a trained pelvic physical therapist can really be beneficial in the 4th trimester, and really should begin following your 6-week checkup. We can assess the status of your muscles and safely guide your progression with your individualized goals in mind, as well as give you tools and education on the many other aspects of life that directly impact your pelvic health, such as nutrition, body mechanics, stress management, and bowel health. So I hope this little lecture was helpful for you. I have loved talking about pelvic floor stuff. If you have any questions, this is where you want to start asking me in that chat section. I'm also going to display my contact information for you if you'd like to contact me directly with a private question or set up a telehealth appointment. Okay.